Hi, I'm Dr. Cathleen. Let's talk a little bit about your thyroid, the thyroid hormone. The thyroid hormone is known as the feel-good hormone. Your thyroid gland is so important. It controls so much of your tissue, cells, and organs. So let's talk a little bit about hormones. What are hormones? Hormones are chemical messengers that have a huge impact on the body. They travel through the blood. They cause changes to the organs and the tissues in the body. They work in a lock and key fashion. What parts of the body do they influence? Well, hormones play a huge role in every single cell, tissue, and organs. So let's start from the top. These hormones influence our hypothalamus, which is located in our head, in our brain, hypothalamus, pineal gland, pituitary gland, the thyroid and the parathyroid, the thymus gland, or organs such as the liver, the adrenals, the kidneys, the stomach, the pancreas, also our endocrine system, such as the testes, the ovaries, and the uterus. Always tired. It doesn't matter how much sleep you get. It doesn't matter how much coffee you ingest. It doesn't matter how much you try, but when you're always tired, that means that maybe your thyroid is not functioning the way it should. When we optimize thyroid function, we actually see that our patients are actually more energized, they're more productive, their anxiety goes down, and their gut health gets better. Not only that, their skin is nice and smooth, and the hair actually grows back. So when that metabolic machine is not functioning right, something is going on. Thyroid function. The thyroid gland produces a hormone that regulates the body's energy metabolism. It also regulates the body's heart rate. The thyroid hormone influences every cell, tissue, and organ in the body. The thyroid protects us against fatigue, weight gain, memory loss, cognitive impairment. It helps to lower our cholesterol, and it also protects us from cardiovascular diseases. Let's talk a little bit about iodine. Our thyroid gland makes T4, which is the inactive form of thyroid, and also T3, which is the active form of thyroid. So T4 has 4 molecular structures of iodine attached to it. T3 has 3 molecular structures of iodine attached to it. Iodine is responsible for the production of all the hormones in the body. The thyroid gland contains a higher concentration of iodine than any other part of the body. Every cell in the body contains and utilizes iodine. The body does not make iodine. Factors that cause the inability to convert T4 to T3. Of course, T4 is our inactive form of thyroid. T3 is our active form of thyroid. T4 has to convert to T3 in your liver and also in your gut. So factors that can cause the inability to convert T4 to T3 includes chromium, copper, iodine, iron, selenium, zinc, vitamin A, vitamin B2, vitamin B6, vitamin B12. When you have these nutrient deficiencies, it inhibits that thyroid T4 to convert to T3, which is our metabolic machine, the active form of thyroid. There's about 80% of your thyroid hormone that's made of T4, which is the inactive form of thyroid, and about 20% is in T3. So we have a guy called reverse T3, which we talk a little bit about that later. So our T4 has to convert to T3 in your liver and in your gut. Then you have reverse T3. Reverse T3 actually helps that conversion to occur. So let's go back to factors that cause the inability to convert T4 to T3. Medications such as beta blockers, birth control pills, estrogen, iodinated contrast agents. Yes, when you go for a CT scan or an MRI, when they inject that, that's not the right form of iodine for your body. It's called iodinated contrast agents. Lithium, people that are on antidepressants, and steroids. Yes, steroid medication. Other factors that reduces your inability to convert T4 to T3. Of course, aging. As we age, our metabolic machine starts to go down. Did you know that your thyroid is the first hormone to decline? It starts to decrease by the age of 25. Alcohol consumption can actually inhibit the conversion of T4 to T3. Diabetes, fluoride, bromide, mercury, stress, obesity, pesticides, and surgery. Remember our periodic table, back to chemistry 101. So if you really look at the chart, you'll notice that on the halogen side, you can see that fluoride, chloride, and bromide. What does it do? It actually inhibits and it competes against the receptor cells of iodine. So what's in fluoride? Of course, in our toothpaste, we put fluoride in there. Water has fluoride, and you go to your dentist and sometimes they give you fluoride treatment. Well, what does it do? It saturates the cells and it pushes out the iodine. It competes with the receptor cell of iodine. Chloride in our swimming pool, also in our water, and in chemicals. Bromide. Where do we find bromide? They throw it in bread, sometimes flour, and also it's in plastics. So these are environmental toxins that actually inhibit your thyroid to function naturally and normally. Thyroid deficiency in appearance. So these are signs and symptoms that you can tell when a patient has a low functioning thyroid or hypothyroidism or Hashimoto's or even hyperthyroid. So thyroid deficiency in appearance shows in a pale face, puffy eyes, thinning of the eyebrows. Usually they lose a third of the outer part of their eyebrows. Hair loss, brittle nails, swollen lips, swollen tongue, dry skin, elbow keratosis, also yellowing of the palms of the hands and feet. So these are thyroid imbalances, and you can actually see that just by looking at the patient. Of course, other symptoms of an imbalanced thyroid will also include depressive behavior, such as fatigue, slow, when they're like so slow, they walk slow, they talk slow, they move slow. Oh, the New Yorker in me just gets so irritated. And a low functioning thyroid can actually cause weaknesses. It can be like weakness in your immune system or weakness in your muscle strength. Anxious, you hear a lot of anxiety, and especially of what's happening in our world right now, in the pandemic world. This pandemic has heightened the anxiety level of a lot of our patients. Brain fog, depressed, poor sense of well-being, hyper agitated. I call them the type A type of a patient base. So again, with the pandemic, their coping mechanism is compromised. So a lot of these thyroid patients that are over anxious or they hyper agitated, it's important for us to step back and look at the thyroid function. Physical symptoms of an imbalanced thyroid or a not optimized thyroid. It includes muscle aches, joint pain, scoliosis, hyperlordosis, swollen ankles, flat feet, constipation, bloated, stubborn weight. Doesn't matter how much they exercise, doesn't matter how much calories they start to reduce, that scale does not move. And taking for my women, when that doesn't happen, they get pretty depressed. Of course, stubborn weight, obesity, always feeling cold, like you're in a room and they're the one who's walking in with that sweater when everybody else is wearing just a blouse or a t-shirt. Delay knee patella reflex. When you do the patella reflex, they probably feel it like 3 days later. Yep, that's hypothyroidism. Ankle or Achilles reflex. Again, it's a delay knee patella reflex or an Achilles reflex. Those are signs and symptoms of a hypothyroid or a low functioning thyroid. They are slow. Hypothyroid deficiencies, the three main causes. Number one, the production decreases due to the lack of iodine or thyroid glandula. Number two, the conversion of T3 decreases because of endocrine disruptors that must be detoxified. Number three, receptor site sensitivity decreases due to aging and toxins resulting from food and environmental. Remember our little chart? Factors that cause an inability to convert T4 to T3. That includes aging, alcohol, diabetes, fluoride, chloride, bromide, mercury, stress, obesity, pesticides, surgery. Let's talk a little bit about the thyroid assembly line. So many patients come into our office and say, but my doctor said my lab ranges are fine. Of course, anybody can look at a lab range and see and decipher high from low. Well, what we want to do is that we want to teach you how to decipher these thyroid ranges and look for optimum range. Optimum range actually allows that patient to be treated and their thyroid function to be addressed before it becomes very clinical. So we call that subclinical findings. So let's talk a little bit about the thyroid assembly line. you have the pituitary gland, which is located in your brain. It sends a message to release the thyroid stimulating hormones. Thyroid stimulating hormones tell your thyroid gland, hey, thyroid gland, produce T4 and produce T3 for me. Of course, T4 is the inactive form of thyroid. That is 80% of your thyroid. T3 is your active form of thyroid, which is 20% of your thyroid. So the conversion from T4, inactive form of thyroid, to T3, active form of thyroid, must occur in the liver and in your gut. So why most providers miss normal versus optimum? Of course, it's the schooling, how we're taught. And these ranges are actually established against a sick person. So they're not ranges for a well individual. And a lot of these patients are coming in with hypo or low thyroid signs and symptoms. They might be very subclinical. That means that cell structure might be a little bit more compromised where it has not attacked or damaged the thyroid gland yet. So let's look at the optimal range. For TSH in functional medicine, we're taught to look for optimal range. The normal range on your lab test, it can be Quest or LabCorp or wherever you go and get your lab tests at. It can range from 0.5 to 5.5. We look for optimum range. Optimum range should be less than 1.0 to 2.0. Yes, depending on the patient's age. Again, I'm going to be approaching my 50s, so I'm a little bit on the vain side, so I want to make sure that my metabolic machine is going to be working. I want to make sure that I have no anxiety when I hit the bed. I'm out, my skin and my hair, these are my real hair. So I want to make sure that my thyroid gland is optimized for me to have the energy that I have. So I like my range at my age group to be less than 1.0. We'll talk a little bit about that. But if they are in their 20s or 30s, maybe they can get away with a range between 1.0 to 2.0. T4 free range is 0.8 to 1.8. Optimum range should be greater than 1.5. T3, which is your metabolic machine, this is really important. T3 range on a scale is 2.3 to about 4.2. Optimum range, we want that metabolic machine to be working, and it depends on that individual too. If we're talking about weight loss or trying to get that metabolic machine going, we aim to bring their T3 levels up to between 3.5 to 4.5. And in another webinar, I'll be talking more in depth about the thyroid, and we can talk about other lab values that I look at. Because we never want to suppress our thyroid, never ever want to suppress the thyroid. We want to optimize the thyroid. And that should conclude everything that you need to know about the thyroid. And I will be doing more webinars in depth about thyroid gland and how important it is for your body to function normally, optimally. So make sure we stay connected. I have a lot of content out there on social media. Follow me on Facebook at Rajanair Wellness, Instagram, YouTube, and also like, follow, and subscribe.